Here we go. CPT 2020 Professional Edition. You may also have the standard edition. It's fine. It just won't have the spiral, and there'll be a few other informational pieces to it that it doesn't have. Still would be fine to use on your CPC board and as a daily manual. I just prefer the professional. And I'll show you along the way in this video the differences between the two. So as we open up the CPT, if you have the professional edition, you're going to see a page. It would have had all of these tabs on it. I've already tabbed this, so now all the tabs are sitting along here. I prefer using the already printed tabs. If you don't want to use them, you can do your own tabs. Just make sure whatever you affix to the pages is authentically a tab and not a big Post-it note or something like that, because that would prevent you from being able to pass a book check when you go to take your board. But any true tab will be fine to use in here. The front cover of the CPT has different symbols that we will cover as we work through the CPT manual. Also has some modifiers that are used. This is a good kind of synopsis or cheat, fast reference. Has some different modifiers here used for the hospital outpatient use, and then has some HCPCS modifiers. This is kind of foreign. I'm just mentioning it. You will come to love this. But right now, probably it's just good information. You do have a reference for your place of service codes. Place of service codes are used to be able to track the location of where the physician or provider services were completed. That goes on the claims. Like a provider office would be 11, inpatient would be 21, emergency rooms 23. There's a lot of different locations where services can be provided. This is pretty comprehensive and is a good list and reference for all of them. Moving along in the CPT manual, if you're brand new to coding, you may not know where this CPT even came from. So there's some good information that can kind of give you the background of the CPT. There's also a table of contents. I personally do not use the table of contents. I don't know anybody who does. If your manual is tabbed like it should be, you wouldn't waste the time to come here. You would just go straight to that organ system and then start trying to find the action, which is the procedure. But it's there if you need it. This introduction section has some good background information. It kind of talks about the different categories that will be in the back of the CPT. I'm not going to go over all of this reading wise because I'm going to show you in the book. So after you see this video, you can certainly come back, read the information, and fill in any gaps of information. I'm a visual learner. I like auditory, so I talk to you, and then I like visually seeing it. And then when I study for stuff, I listen, I see, and I write. I rewrite notes and that kind of stuff. And then that helped for me. That's my study technique. Okay, moving into this next section, prefixes, suffixes, and roots. The basis of coding requires a strong understanding of medical terminology. So if you are starting coding and you don't have a good foundation in medical terminology, that may be an area that you want to seek some help in. I'm sure there's YouTube videos or some free courses or on Quizlet.com, flashcards, something that would be able to help you. At a minimum, as you go through this course, I would recommend you have a spiral notebook and when you're sitting studying and you come across terms or disease processes, medical words that you do not understand, and you're not seeing the prefixes and suffixes that you do understand, I would write those in the spiral notebook. At the end of your study session, go and research everything that you've put in that spiral notebook so that the next day you can start again writing words down, but you have a foundation that you can start from. When I got out of nursing a few years back, meds change very, very often. And within just a few years, I was rusty on all the current meds, you know? I mean, there were still a few of the old ones, but the meds seemed all different to me. So that spiral notebook is what I did for myself. And at the end of a day of working, I would have written down all the meds that I was unsure about or had to look up or guessed at, you know, something like that. And then I would research them, and slowly I built myself back to knowing all my meds, and would be able to get through a chart review easier with a higher level of knowledge. All right, so we do have some pages of pictures. I love pictures. Every section will have their pictures. We'll see that as we go through. The pictures are a great way for you to write notes in to help you remember a procedure or an action or a term or a disease process, something like that. Any notes that you physically write into your manual would be fine for a book check. Okay, so this first section is called the Evaluation and Management section. We do have several pages of tables that are absolutely foreign to you right now. That's okay. There'll be a video on the Evaluation and Management section, so we'll cover that then. For right now, we're just getting used to the CPT manual. So as with the beginning of every section, the Enm section starts with its own little table of contents, color-coded, and then goes into what I call green pages. The green pages are guideline pages pertinent to that area of the CPT. So unlike the ICD-10 manual, when we cover it, all of the guidelines for ICD-10 are in the very front of the ICD-10 and apply to the whole book or whole manual. For the CPT, every section that you'll tab has its own particular set of guidelines. So this would be the guidelines pertinent to evaluation management. We're not going to learn that right now. But on the evaluation and management section, we will be working through these. I can't say enough. You'll hear me say it 100 times if you hear me say it once. You must know guidelines. You have to know guidelines on CPT. You have to know guidelines on ICD-10. That is the only way that you will accurately find and apply the correct code for whatever scenario that you're looking for. Okay, so this Enm section, essentially what it is, and I do have notes in here, but I'm going to cover all the notes once we're just in this section, and the whole video is about this section. So essentially what evaluation and management is the code that pays for the doctor's time. It's his office visit, his time in the emergency room, his time when he sees you in the inpatient hospital, outpatient observation times. This is a professional code paid to the provider of the service. And I know I sound funny when I'm talking, but you'll get used to me. But there's a reason why I'm talking. Nothing in here is a procedure per se. There's no cutting. There's no removing. There's nothing. This is for the professional payment to the physician or provider. Could be a nurse extender or an extender. I guess those are PAs too. Sorry. For their time and expertise in diagnosing, rendering, and determining the plan for whatever the health need was for that patient. Consultations are in here. Say you go to your primary care doctor for an office visit, that's going to be over here. You're established to him. So you're an established patient, that it'll be determined in here, one of these codes. And at that visit, he decides that you need to go see a pulmonologist because maybe you have early COPD or something. So he wants you to go to a specialist. So then the specialist would be considered a consultation because there would be a formal letter from your PCP to that physician getting you in, of course, depending on your insurance. So that's kind of how some of these work. Nursing facilities, the doctor's patient or the provider's patient could be in a nursing home, and so he has to go there to render care. So in here would be where you would get that type of code. You have home services. Believe it or not, there are docs who go to homes. My husband's doc, who I love him, and I can't say his name, will go to patients' homes, and I think it's just really refreshing. Different prolonged services that we will go over once we're in here. I'm not going to go over all of this, but you have some non-face-to-face, you have some different counseling, you have all that online email and online telemed stuff. That's all in here now, which is really exciting. You have different insurance required services, maybe to get life insurance or something. You have newborn care, pediatric care, neonatal care, ICU care. All of that is within here. It's a fun section. I will say traditionally, this is probably one of the, quote, harder sections, simply because it's very, very subjective. So I will try to break down the section the best that I can, because you have to take components of the note and put it into a level of service. It's just difficult. So the first video that we'll do over E&M will be that overview, just to get us used to the codes and maybe finding a few levels of service. Then when we get into the next step textbook, that textbook will actually get us really into the weeds, determining how many parts of the HPI or how many organ systems within the physical exam, that kind of stuff, to get us to a level of service. So we'll get there in a few steps. It'll just take a little while. The next section is your anesthesia section. I have mine tabbed. Remember, we'll go over all the notes once we're in those actual sections. It does have your index, then your green pages. Remember, green pages are guidelines. I've said this on probably 5 years of videos. Hopefully, with the second set of videos, we can get a little bit more technical than I have in my previous videos. That's my point of this. So again, anesthesia is going to cover all of the body parts that are involved in the procedure that is being performed. The anesthesia codes are only paid to the anesthesiologist or the nurse anesthetist. We all know when we have our gallbladder taken out, we have anesthesia. So the surgeon who takes the gallbladder out will not claim these anesthesia codes. The anesthesiologist or the nurse anesthetist will. Okay? And again, that's every body part that you can think of will be in there. The next section is the surgery section. I don't actually tab this. It's only 2 pages long, right before the skin integumentary. I just know it's there. So we have a little bit of some guidelines, green pages again. We will talk about unlisted codes. We do have some illustrations. This is actually an illustration for the skin or the integumentary system, not the surgery section. Here's the surgery page. and then it goes right into the integumentary. So there's very little. Most of these quote general surgery is your fine needle aspiration, your biopsy stuff. Then it goes into the skin. Integumentary is skin. So this is going to be anything skin deep. Anything that you can have done skin deep will be in here. It goes a little bit into the fat some places, but if it gets very deep, then it has to go into the musculoskeletal. So that's just a little bit of an overview for all this skin stuff. We can shave stuff in here. We can snip it off. We do nails. We do cysts. We do benign lesions. We do malignant lesions. There's all kinds of stuff we do in here. So I'm just going to kind of get through the integumentary. And then we move to musculoskeletal. Again, we have good illustrations. We kind of gain illustrations as we go. Musculoskeletal is going to be anything fascia, muscle related, and anything bone related. So you could have your fractures in here for any part of your body. You could also have muscle masses removed. It's just kind of a gamut of stuff. And again, the videos that I do for each of these organ systems will be very detailed into just that area. Right now, I'm just getting through the CPT manual. So this is the musculoskeletal section. Has all kinds of stuff in it. Grafts and shoulders and hips and all kinds of stuff. Then we move to the respiratory system. This is pulmonary. Anything lung related is in here. This section does go from where you take your air in. So nose, into your pharynx, into your larynx, into your lungs. That's all kind of covered in here. And you can see because it starts with the nose. So that's where you start. That's where the respiratory system starts. We know this because we have upper respiratory infections and we have lower respiratory infections. So your upper is generally pharynx, nose, upper part, and then your lower respiratory system is going to be into the lungs, bronchi, that kind of thing. Okay, so this is the respiratory. After respiratory, we go into cardiac. This is probably the next hardest section. Not that I want to set you guys up for, they're just the sections you probably need to pay a little bit more attention to. Again, the cardiac section, just like in the Enm section, we start small. We start with getting a little bit of knowledge, and then we just build on that foundation. Again, we have our good pictures, and we have our table of contents area, really good pictures in here. Then we have, we don't have a green section. So for cardiovascular, you will see green writing. This is kind of where I'm going to start talking about how you actually read the codes. Anything that has the green writing is new. It's been text put in to further clarify. And it's kind of hard for you to see the green. I don't know, here it's black and then this is green. Maybe you can kind of see the difference there. Across the bottom, let's talk, I'm on page 216 and 217. It's the very first page of the cardiovascular system, regardless what manual you're in. Let's go across the bottom because these are the same symbols that they have here on the front cover in the left. So let's talk about them a minute. So if you see a solid black star, that's a telemedicine code. So that's fairly new. They haven't been around too long. And it's just telling you that that's going to qualify under telemedicine. Your plus sign means it's an add-on code, and I'm going to talk about add-on codes in a minute. Your lightning bolt is your FDA approval pending codes. So these are probably temporary codes that as more providers follow that technique or that surgery, they become more and more popular. And so eventually they won't be pending, they'll just get put full-fledged into the manual. You've got your number sign. That means that the code's been resequenced from somewhere. We do find that quite a bit. It always trips me up, and then it takes me pages to find it. That's just the way it is. Your modifier, your circle with a line through it, is your modifier exempt. We'll talk about that more when we talk about modifiers. And then moving across the page here, you have your revised codes with the triangle. You have your red new code, so that would be new. You have your sideways triangles, and that means there's been, as you can see on this page, sideways triangles means there's been new or revised text put in. Generally speaking, it's to help us clarify. There were problems with that code maybe the year before, and so now they've added something to help clarify how to use it. We won't worry about those other ones for now because you're not going to encounter them very much at all. So that's kind of how to use your legend. Now, let's look on page 219 of your CPT. Starts with code 33202. 33202. I'll give you just a sec to get there. Doesn't matter what that code is or what it says or if we understand it, it doesn't matter. I'm just going to show you how to read your actual codes. So code 33202, insertion of epicardial electrode, is all the way butted up to the number code. The description is butted up to the number code. If we look down to 33203, it's indented underneath. So this one is all the way by the number. This second one is indented this way. So anytime you hear about indented codes, this is what they're talking about. So if you were looking for a code description and a procedure that said insertion of epicardial electrode, open incision, subxiphoid approach. If that's all of your documentation, then you would use code 33202. Now, in that description, do you see the semicolon right here before open? It's right there before open, kind of hard to see. Your eyes will get used to looking for the semicolons, I promise. So how you use the indented code is insertion of epicardial electrode, semicolon, so you stop reading any more of that description and you add on endoscopic approach. So that would be code 33203. So if you have a patient having insertion of an epicardial electrode, they can either be done open incision or endoscopically. That's what this is telling us. So if your op note said it was done through an open approach, you would use 33202. If your documentation told you that it was done through an endoscopic approach, you would only code 33203. Okay? So that's how we use the indented. And we'll keep going over that. Let me find an easy view of an add-on. Hold on, I'm getting there. I always do stuff flying by the seat of my pants. No, that one. I don't like that one. Let's go back some. This will help you to get into your CPT. I don't want to do most. Okay, so on page 95 is where I'm at right now. Actually, yeah, 95 is fine. These are all skin grafts. Doesn't matter where I'm at. I'm just showing an example of an add-on code. So let's take code 15110. 15110, epidermal autograft, trunk, arms, legs, first 100 centimeters. Say you have an op note and the doctor performed an autograft on an arm 100 squared centimeters. This is the only code that you would use, 15110. If you have an op note of an epidural autograft of an arm that included 150 square centimeters, you would use 15110 and then your add-on code right behind it plus 15111, which is each additional 100 square centimeters or part thereof. It kind of it has that 1% body for infants and children. But to get 150 square centimeters, you would have to use code 15110 and code 15111. And that's what an add-on code is. You cannot use an add-on code by itself. It always has to piggyback on something else. Always, always. Okay? So that, and we'll cover more of this, but back to our cardiovascular system. Just kind of working through. After the cardiovascular, we come to, we come to the digestive system. Again, we have our table of contents pertinent to this section. We have our pictures. And then we start our digestive. And you will see your digestive starts with your lips because that's where we take the food in. And believe it or not, your digestive will end with the anus. And so we will pick this section apart once we get there into that organ system. From digestive, we go into urinary. In the urinary, of course, we still have pictures. Really good. If you have the standard edition, this is kind of where they start differing because your standard edition has a few pictures, not a whole lot. They're not colored. It's all black and white. They don't have any of the table of contents, which could help you. And they just don't have as detailed a pictures. That's just one of the things that I like. I like it being in color. I like the pictures. I like stuff just dumbed down for me to where anybody can understand it. That's my preference. So this is urinary. From urinary, we go into the malgenital, which isn't very long. And it has, so at least look at pictures, has the pictures. Then we have the female genital. Female genital is a little longer. We got a lot of stuff that can go wrong. At the back of the female genital, we have all of our maternity care and delivery. And good pictures. After maternity care or female genital, we have the nervous system. Lots of stuff in the nervous system. It has the brain, it has all the spinal cord and column, it has all the nerves, it has a lot in it. This is a little bit more involved section. You just don't see nerves. It's just a little bit harder to get your mind around, but that's okay. That's okay. So after the nervous, we have our ocular and auditory, so our eyes and ears. Again, we have our index. We've got pictures. You've got your eyes first. Then we go into our ears, auditory. Ears aren't very long. You have inner, middle, and outer. That's about it. Then we're done with what they call the surgery section. So surgery section includes all of those organ systems and all the procedures on the organ systems. Now we're getting into some of that ancillary stuff, what we would call ancillary services. So the first is radiology. This is going to be all of your x-rays, all of your MRIs, your MRAs, your CAT scans, your ultrasounds, some ultrasounds. Okay. We should have a green section of our radiology, which is good. From radiology, we have our pathology and our laboratory. This is probably one of my favorite sections. They keep adding these molecular pathology tables. I usually, by the time you see this video, when we're covering this section, I will have paper clipped this to where I don't have to go through every page of it. And then if I have anything pertinent to it, I would just go to my paper clip. But that's just a chunk of pages. We just don't get in that much. There's just not everyday use there. But I went too far. Now see, I would have paper clipped it too far. Okay, so here would be starting our labs, not our pathology, but our labs, different panels, our drug testing. You get into chemistries, microbiology, hematology, all of that stuff is in here. And then you move to, we even have more molecular testing here. Just pages and pages of this stuff. I'm trying to get into, there's our hematology. I'm trying to get into the pathology part. We're close. There's the microbiology. That's usually my favorite. That's where all the cultures are and stuff. Your post-mortem exams. This is your autopsies, if you happen to code for that. Then we get into the surgical pathology. Any surgery that's done will have pathology. Even if it was normal tissue, that skin tag that had to be clipped off, it will go to pathology. So you have different levels. We'll learn all of that. It's good stuff. Okay, so from pathology and laboratory, we have the medicine section. Medicine section is a catch-all, a little bit of everything. We've got a little bit of cardiac in here. Didn't fit in the other cardiac sections, so they've just stuck it in here. So kind of a lot to get your head around for this section. I'm telling you the harder sections in my opinion. Medicine's kind of all out there. You see how long the index is. It's just a catch-all, my opinion. In the medicine section, this is where you're going to find your vaccines, administration of vaccines, your IVs, your chemotherapies, some ultrasounds, your eye exams, your psychiatry, just all kinds, just a whole mix of stuff. Your electrophysiological studies, cardiac mapping, echoes are in here, which is ultrasounds, but just of the heart. Just a lot of stuff in here. So again, how this course is structured with the different videos and textbooks. We go through all of the manuals in the 321 Coded book. We get a basis understanding. Then once we move into the next step, we hit all of those body systems, organs, areas, harder and more advanced. So we already have a basis of foundation from the 321 Coded book that then we can take on to the advanced part of it. I really do think a lot of the feedback I've gotten over the years from the students I've taught, there are some students who cut corners and didn't want to complete the next step portion, that advanced coding portion, and they regretted it. So I strongly urge you to walk through this, how I'm kind of prescribing it, because it will just, in a more natural way, I don't know, a really awesome way to say that, it will naturally set you up to slowly build your foundation. Okay, so after the medicine section, we are done with all the real codes in the CPT manual. Then you start your category 2s, your category 3s, Your category 2s, all of these codes end in an F. They are a lot of your performance measures, quality. They all end in F, so I call these F codes. I'm not trying to be silly, but I just call them F codes. Your category 3 codes, all of them end in T, where I remember category 3 T codes, those are temporary. These are the procedures or techniques that the providers are working on, trying to either get approved through the FDA or get a lot of the other providers to use the same technique to get it into mainstream. So that's kind of your category 3s. Then we go into all the appendixes or appendices. Your appendix A, I'm not going to go through all of these. We will have a video about modifiers. Modifiers are kind of sticky. There's only so much I can sit and tell about a modifier. The best way to learn modifiers is to use them. So as we have scenarios, I will try very hard to explain why we're using that modifier. If you forgot it, why you need to use it. If you used it, why you shouldn't use it, that kind of a thing. But this is a good reference. This kind of defines every one of the modifiers. Let me get back up here that were here. Okay, that are on this sheet, the little front sheet. These have all of the modifiers with their descriptors. The only other appendix that I'm going to show you is Appendix L, and they have made this fantastic from what it used to be. Appendix L, and this is a lot of color. Oh, it just got bright, didn't it? This is your vascular family. So when we're in the cardiovascular section and we're having to determine first order, second order, third order of the vasculature of a patient, this is where you would go to find it. And so I just wanted you to know this is here. I usually tab this. Why I haven't this time, I don't know. I think the tabs came a little different. They came K through P and didn't have an L this time. They should make one just for the L. So we will get in here and talk about this a little bit more. And then the last tab that I have is the actual index. As you're learning the CPT, I totally get that you would be in this index looking up stuff. Sadly, this index does not flow like an index would that you're usually used to. It's a little bit difficult to find stuff in here. It's okay to use this at the beginning to get used to your organ system. Again, I caution you, if you're coming close to the time that you're going to take your CPC and you're still heavily dependent on the index, you don't know your organ systems or your sections of the CPT well enough, and you need to go back and really study them. I'm hoping that by having individual videos for each of these body sections and picking through probably 60-70% of the codes in every section we will have talked about, that should give you a comfort and a familiar feeling in each of these sections so that you can gain your confidence and not have to use the index. So I hope I didn't use too many times. It drives me nuts that I do that. It's very difficult to change the habit and not do that. I am working on that, I promise. But that is the introduction to the 2020 CPT. The next video will be on modifiers. Yay! Okay, so message me or make a comment if you need anything. And we'll just kind of flow with this and we'll tailor this course to whatever you guys are needing. So I'll see you in the next video.